Yeah, good afternoon. Hello, welcome again to the Usrin Health Talk. Um, my name is Dr. Vincent Ng. I'm from Lifestyle Clinic in Bangsa South. Um, the talk will be sponsored by Usrin. We'll primarily be talking about eczema-related topic and also the dry skin that comes with eczema. For today, we'll be talking about the do and don'ts for skin when traveling. Um, as usual, the initial part will involve a short lecture talk, about 15 minutes. And after that, those that tune in, you're welcome to PM us questions, anything that you want to ask regarding eczema or dry skin. And of course, on today's topic, the do and don'ts for traveling for skin when traveling. And for those that manage to PM us a question, you'll be receiving a free gift from Usrin. You'll be receiving a soothing cream as shown here that is worth about 65 ringgit. Okay, without any delay, I'll start the talk. Like usual, we'll do a little bit of recap. For those that have been following my the 4 talks earlier by Usrin, you have a very good idea by now what eczema is. But for those who have just tuned in for the first time, here's the short recap. Atopic eczema, or they call it atopic dermatitis in the medical term, is actually a type of inflammation skin disorder associated with the immune system. It is actually a illness that is very common in Malaysia. About at the moment, estimated 1 in every 5 in the country has eczema. Atopic eczema is a genetically linked condition in the sense that it can be inherited, but surrounding environment plays a big role in this illness as well. What do I mean by that? Meaning that with the genetic susceptibility in the patient, together with the environmental influence, can make the illness worse or actually improve it. Like I said, atopic eczema is a very common condition in Malaysia. About 1 in every 5 children has it. But it is also good that I stress out that do not label every child of yours that have a bit of rash as having atopic eczema. The first most important thing as parents is to see a medical doctor, get a medical diagnosis to verify that it is atopic eczema in the first place. Once the diagnosis is made, then the doctor will counsel the patient and also the parents per se as what need to be done, the treatments available, and the preventions that are available. As we have mentioned over the past few talks, atopic eczema patients comes with generally has a very dry skin with a kind of with rash, a red rash around the flexure areas. And this dry skin will follow the patient a whole lifetime because in the skin they lack certain elements that retains water. Hence, for a patient with atopic eczema, a topical moisturizer is very important. What kind of moisturizers are available? There are many available in the market. It ranges from simple ones, let's say from Eucerin for sensitive skin, pH lotions as such, to the more specific and the more clinically researched specific for atopic eczema patients, such as this soothing cream, that for those that PMS question will be receiving one free as well. And because of the rash, one of the most important symptoms the patient complain about in eczema is itch. And itch can be very, very irritable. Most of the time, as medical doctors, when we aim to control the rash and also control the symptoms of itch, which will drastically improve the patient's living quality. Right? But it is good also to mention here that a lot of patients grow out of their atopic eczema. About 65% of them gets better as they reach 15 years old. For those that do not experience this resolution, tend to have worse eczema and need to be more careful in what they do. There is no known long-term cure for eczema. What we aim to do is keep the disease controlled so that the patients do not have flare-ups. And these flare-ups can be minimized by minimizing the contacts with anything that triggers allergens that triggers the illness itself. and also very, very good skin protection long term. Okay, so we will go into our topic for today, which is do and don'ts of traveling. Maybe what I'll go through is some tips for skincare for eczema patients, right, when traveling. Okay, here we go. The first thing that comes to mind that when we travel is when we go to a different country, especially there will be drastic changes experienced in temperature and humidity. So it's often unavoidable because, however, proper planning and preparation can be done before traveling. What do I mean by proper preparation and traveling can be done at home before traveling? Example is one can look up in the internet, which is so easily available nowadays, to see the temperature at the area that you're going to travel to and the humidity of it. So it can help you prepare such as your clothing and things to bring along as well. Because one of the important factors that happen is when we move across different countries, our skin are exposed to this new environment, and our skin needs time to adapt. And also, actually, sometimes, let's say, drastic environment as from a hot, humid country, we go to a cold, freezing country in winter, the skin will be exposed to this drastic shock, new environment that can trigger off the eczema. So let's say if we are traveling to a colder country, this means the skin definitely will be exposed to a harsher and also a drier environment. It helps patients to bring thicker clothes that are less irritable, maybe with less irritable materials like wool and so forth, that can help patients keep them warm and also not irritate their skin. And in also colder, drier environment, we know that the patient will drastically need a lot more moisturizer on the skin. And the patient can actually start by applying the moisturizer even before they travel. They can start up to 1 week earlier by preparing their skin for this exposure to the cold weather. In colder environment, also when we get there, the moisturizer application should be increased. Let's say, for example, if you're in Malaysia and the patient is used to using it twice a day, day and night, when you are in a colder environment, always remind yourself to constantly apply it more often. If you are using a proper moisturizer that is non-irritable, more applications will not cause any complications at all. In fact, it is even more beneficial. It is also not only that the country is cold. Most of the time, the cold and dry environment starts in the airplane itself. And most of the time when we're in the airplanes, especially with the strict laws nowadays, we're not allowed to carry tubes of moisturizers as such, or any tubes, in fact, on the plane for us to reapply. So it is important that we apply enough moisturizer before we travel. And once we reach our destination, we've landed, just to reapply another layer before we go out of the airport. This is something very, very small, but can make a lot of difference to a patient. Right? This gives a good head start to the patient's skin health. Again, you can start applying moisturizer 1 week up to 1 week before traveling. Proper planning of moisturizer application before airplane. Once we reach the country of destination in a cold country, use more moisturizer. What about, let's say, if we were to travel to a country that is very hot and humid instead? Okay, most of the time, hot and humid, yes, the skin will be moist, but comes another problem of sweat. Too much sweat sometimes coupled with sunlight exposure actually can irritate the skin. It can also be a form of trigger for eczema. Then in that sense, we can still use moisturizer, but we also need to try and keep our skin relatively cool so that comfortable dressing, loose-fitting clothes or soft clothing can help. And also try not to scratch if, let's say, the area per se gets itchy. And how do we do that? Sometimes, if really needed, we can get some oral medication as a prophylaxis from a medical doctor before we travel in that sense, right? So in summary, first point is that your skin adapts to climate gradually when you travel from a country of differing climates. And it is often that during this period of time, it suffers and ages, and it needs time to self-repair. And we, as medical doctor or patient themselves, can help your skin adapt better and prevent more damage from being done. Okay, then come a few other point number B. So point B will be sometimes when we travel, we are exposed to common allergens, common trigger factors that can make eczema worse. First of all, if we were to check in into any hotel, definitely they will provide the bath soap and then the moisturizers as well. But most of the time in the hotel, the soap itself is very harsh. They are not soap free, which should be only used on eczema prone skin. And also the moisturizers that are provided sometimes are not thick enough, not good enough, and also they will be scented, meaning they will have more chemical ingredients in it. So as far as possible, like I said, pre-planning, bring along your traveling kit, bring along a proper bath oil. Of course, it may be difficult to bring one whole big tube of bath oil like such, but you can also pre-pack it and bring it along with yourself, and bring your own moisturizer. Again, I stress out here, a lot of time moisturizers and the soap provided by hotel are not ideal for eczema prone skin. And then in terms of bed sheets as well, okay, there's sometimes it is important that choosing a proper hotel, higher star rated hotel helps, because most of them comes with better hygiene, better cleanliness, meaning the duvet cover will be cleaned properly and also dried properly, air dried properly, and there will be less allergens to it that can irritate the skin. So choosing a hotel can also be a big difference for patients with eczema. And then again, when we talk about climate as such, as we mentioned earlier, most of us like to, let's say we go to a cold country, when we're outside, we feel very cold, and once we get to the hotel, we put on a heater full blast so that we feel warm and cozy again. But for eczema patients, let's say in such a scenario, it is better for them not to have this drastic change of climate in the day. So it is better for a patient to try and maintain the room temperature to just about similar to the external temperature, so that they do not experience this drastic change when they go in and out of the hotel, which can actually suit the skin and make the skin less irritable. Food triggers. Food can also be a very important trigger for atopic eczema. But in terms of food, what can be done? Again, proper research. If let's say patients are traveling with tour, they can of course discuss with the tour guides if they know their allergies and things, the trigger factors, they can actually discuss with the tour guide or the tour companies to provide the necessary food that they can take and avoid those that they cannot take. Of course, this comes usually with increased cost, but I think it will be worthwhile. Other than that, patients can also try and go for food with less chemicals that are in it. More fresh fruits will help. Fresh fruits and vegetables, clean, are also good for the diet while traveling. And then during traveling, sometimes it is also important to plan. Like we say, it's easy for us to say not to scratch the skin. Sometimes when we travel, we do not bring along our nail cutters and such. So maybe before traveling, you can cut your nails at home, so that patients, when you experience itch, when you scratch, it will not be that damaging, because your nail has already been cut short. And then again, finally, what I would like to say is, patient can always consult a doctor before traveling. The doctor can gauge the patient's skin condition at the time before traveling and advise on what is needed. Sometimes the doctor, if let's say the doctor detect early a patch of eczema flare up, or an upcoming eczema patch flare up, the doctor can quickly prescribe some topical medications to get it controlled before traveling. And if let's say in cases that they do not have any patches of flare up, the doctor can actually advise on prescribe some topical prophylaxis, meaning they can hold on to certain cream that they can pack along in the traveling kit to overseas, so that let's say if in the case where really unlucky and there is a flare up, they can start applying immediately. Even not only topical agents, prophylactic oral medications can be given on case-to-case basis. That's why it may be good sometimes to plan with the doctor. Just see a doctor maybe 1-2 weeks before traveling and get an opinion and see what can be done. Right? Basically, these are those few tips that I would like to have pointed out during traveling. What can be done, and what to avoid to prevent worsening of eczema during traveling. Just a quick recap. Temperature and humidity is one of the factors. Try and protect your skin properly. Try and not expose it to drastic temperatures. One. Number two, topical application of moisturizer is very, very important. You increase the amount of moisturizer applied in cold country. You apply the moisturizer as per needed in warmer ones. Clothings are also very important, depending on area where you travel to. Proper skin care products during traveling, bring along your own moisturizer, bring along your bath oil or your soap-free bath, and also consult a doctor. Keep your fingers short, keep your fingernails short. You can consult a doctor before traveling to get some advice on what to do. Basically, that are my few tips for traveling. I'll be taking some questions now. Feel free to PM us any questions. I'll do my best to answer them. For any one of you that managed to PM us a question, you will be receiving the soothing cream free from Eucerin, sponsored by Eucerin. It is worth about 65 ringgit, right? So send us questions now. Okay, we have our first question. It's from Jason. I'll read out the question. I want to ask if seasonal change or pollen will trigger allergy or not. Because when I feel hot, there will be red rashes on my face and body, but it will fade away after 10 minutes. What should I do? Okay, maybe we'll break the question down to a few parts. The first part is I want to ask if seasonal change will trigger allergic eczema. As I've explained earlier, seasonal change meaning temperature and humidity. Yes, it is one of the triggers for eczema, because when our skin get exposed to different temperatures, especially the drastic ends of temperature, extreme cold or extreme hot weather, our skin need time to adapt and also the heal. But during this period of time, it can possibly trigger a bout of eczema. Also, in the same question he asked, I want to know if pollen can trigger allergy. Yes, pollens have been known to be one of the trigger factors of eczema. That's why, especially in other countries, there are 4 seasons. Sometimes eczema improves during the certain months and worsen during another month. So pollen is a known allergy for eczema. Again, but how do you prevent this? If you know that you're very allergic to certain house mites and pollens, which can be tested clinically through blood tests in Malaysia, and when you're traveling to such country, you can consult a doctor. Maybe the doctor can start you on a oral medication course to prevent this from happening. So if you have such case, do consult a doctor before you travel. Next part of the question by Jason will be, when I feel hot, there will be red rashes on my face and body, but it will fade after about 10 minutes. Most of the time, it may not be a rash. It may be just a physical vasodilation. I mean, okay, when we feel hot, our blood vessels tend to dilate a bit to release heat from our body. Maybe it's because of this, that increased blood flow to certain areas, you look about red. This is generally, it can be actually a normal adaptive mechanism by the patient. There is nothing to worry about. But if you feel hot and if you have red patches coming out, meaning like mosquito bite patches, those can be skin being, it may demonstrate a skin allergy to hot temperature, which we call it urticaria. Those need to be, can be treated. You can take some oral antihistamines for it, but those are different things. What I would advise you to do is, maybe when you do get these kind of red rashes, when you feel hot, just consult a doctor and see get the diagnosis right in the first place before jumping to any conclusion. So I hope I've answered the few parts of your question, Jason. So question number 2, it will be from Miss Jane Chai. I've always had redness on my chin, around the nose, with no pain. Is the soothing cream suitable for treating such redness? Okay, Miss Jane has redness around the chin and around the nose, but there is no pain. She didn't mention if it's itchy or not. So is the soothing cream suitable for treating such redness? Well, first of all, the soothing cream, what you meant by is the one that is here by Eucerin. This cream actually is very good in the sense that it has anti-inflammatory properties. It can be applied even on actually normal skin. It will not cause any irritation. And if let's say your redness has got some eczema base to it, that means in the line of eczema kind of rash, it will help definitely. But if it's just a normal redness from other causes, it will not cause any problem. So you can try it out and see if it improves. If it doesn't, consult a doctor, get a proper diagnosis for the redness. If let's say redness around the nose or redness on the nose, it can be something else apart from eczema. It can be some acne-related condition. It can be rhinophyma, a few other conditions. Same thing as in redness around the chin. It can be a fungal infection patch or things like that. If in such cases, the soothing cream will not help, but I can assure you it will not do any damage as well. You can try it out first if you're keen, and or if you already have it, since you'll be getting it free. And if it doesn't help, just go see a doctor and see what the doctor say about that particular redness. The next part of Miss Jane's question is, the cream seems to be dealing with eczema, and yes, it should be applied on redness area or the whole face before or after moisturizer. Okay, this cream can be used as a moisturizer, so it can be applied on the whole face. You can apply on eczema area per se, but usually patients with eczema, generally, let's say if you have eczema, your whole face will be drier than normal, so you can actually apply over the whole face, and it is a moisturizer. So if you're already using this, I do not think you need any extra moisturizer. But we have a lot of patients that like to apply different brand of moisturizers on it. But I can assure you, if you have one good moisturizer, it's more than enough. Most important thing is, let's say if you have eczema prone skin, your moisturizer should not contain any chemicals or any product that can irritate or trigger the eczema. Right? I hope I answered your question, Miss Jane. So we'll take the third question. Miss Annie, right? The question sounds like this. Other than applying skincare products, any special advice on clothing? Some of my winter is made of wool that worsen my skin condition, because sometimes it causes itching on my skin. Okay. Of course, if you're traveling to a colder country, first of all, yes, applying skincare product is one of the biggest thing that you can do to help your skin adapt. When you say skincare product, what I meant here is proper moisturizer. Even let's say if I myself travel with normal skin to a cold country, let's say during winter time, I'll bring along usually such moisturizers to be applied more regularly, because colder environment dries up even the normal skin. And if you're there for 1 week, a lot of patients will come back with a kind of itchy rash, because extreme cold irritates the skin, and the skin actually triggers a kind of adaptive mechanism that produces a kind of rash that is related to the cold climate. So by applying a lot of moisturizer, you actually prevent this from happening. But most of the time, some of us will still come back with an itchy rash. But once you put proper nursing care to it, it will disappear in a week. Okay. After we said about normal skin, when you bring an eczema patient who has dry skin to a dry environment, it will definitely aggravate the dryness of the skin even more. So they will definitely need higher end, higher end, better quality moisturizer that can help their skin, where this will come in, such as the soothing cream. There are also a few more in the market. You can always look it out, but they will probably need higher end and also higher frequency of topical application to prevent this from happening. And if they do get a trigger of eczema when they come back, it usually lasts longer, but it can still be treated. Consult a doctor once you come back. Probably some topical steroids or maybe some oral medications will help immediately. Some of my winter clothing is made of wool and irritates the skin. Yes, as I said earlier, a lot of winter clothing are made of wool. Yes, and it can be a bit, it can be kind of allergens that irritate the skin as well. So in that sense, maybe you can try look around for something that is less irritating for the skin. I'm not too good with fashion, so I can't give you much much advice, but I'm sure there are a lot available out there. Just cut down the direct contact of your skin with the wool in the winter clothing should be fine, I think. Okay, so we'll take the next question. Okay, Mr. Jason from the first question posted another question. He said that I've already consulted a doctor. The oral medication that he gave me only helps to cure the redness, but not the itchiness. Do I have to consume the medicine for a long period? Okay, usually let's say we break down to your signs to red skin and your symptom to itchy skin. Okay, usually they go hand in hand. When the skin is less irritable and there is no flare up, the redness will disappear. And in time, after the lesion disappear, you will need to allow a period of about 10 days to 2 weeks for the symptoms of itchiness to reduce. Most of the time, patients tend to, I can understand it can be frustrating, but that's why patients expect instant cure on the redness and the itch itself. But sometimes it's easier said than done. Once we've controlled the flare-ups, the redness will disappear, and in time, inside 2 weeks or so, the itchiness also should subside. But if you do not get the resolution of the itch symptom, maybe you should check with the doctor again and to relook at the treatment, and perhaps you need a longer oral treatment course. And how long, and do I need to consume the medication for a long period? This is usually patient dependent. I've seen patients that need oral medication for up to a few months, but I've also seen patients on oral medication for a few days. It really again depends on how bad is the skin condition and how long you need the medication for. The best person to advise you will be the attending doctor, or you can come around if you need my help as well. Okay. The next question is from Miss Eunice. Her question sounds like this. My girl keeps scratching her hands and legs. All the marks are not recovering at all. Do you think this is eczema? I've applied the cream that the doctor provides, but it is not helping. She is still scratching her skin non-stop. Okay, how old will your girl be? I'll assume that your girl is under 12 years old, right? Okay, most of the time when they are scratching the skin, it is not normal, definitely. Normal skin do not itch. There is definitely some underlying pathology going on, something that is irritating the skin. One of the causes, yes, like you say, it can be eczema, but there are many other causes that can cause skin irritation, like certain fungal infections as well. So you need to consult the doctor again to get a proper diagnosis. But she has also mentioned here that the doctor applied a cream. You have applied a cream that has been provided by the doctor, but it is not helping. In that sense, that let's say, that's why I say you need to revise the diagnosis with the doctor again to relook at the treatment. If the treatment is working and it's working right, it should give a resolution to the symptom of itch itself, and over time you should see skin resolution. Most of the time, sometimes we have to be frank here, a lot of doctors, they do not prescribe enough moisturizer for patients. They do not spend enough time to explain to patient the pathology of eczema. Most of them, I'm not trying to point out any fault, but some doctors, they tend to give a short course of moisturizer with a short course of topical corticosteroids to control the symptom. Sometimes once the course finishes, the symptoms flare up again. So that is why we as parents should look out for a long-term maintenance for the skin dryness, as in you can talk to your doctor and see if, let's say, your daughter is, let's say, really has eczema and it's eczema prone skin. The skin is definitely dry, so a short course of steroid should control the symptom. But long-term wise, you need to find her a very good moisturizer that she needs to be applying all the time to improve the skin health and then prevent the exacerbation of the eczema itself. And you also mentioned here that the marks are not recovering. Okay, let's say if there are scratch marks on the skin that are very, very deep, you'll most of the time inevitably end up in some form of scarring. You can end up with color scars, let's say the brownish color marks called post-inflammation hyperpigmentation, or you can even end up with physical scars, like the normal ray scars. How to prevent this is we need to prevent the skin damage in the first place. Try and get your daughter to keep the fingernails short. If, let's say, it itch very much, you can consult a doctor and see if she's suitable for certain kind of physical wraps around the area to protect the area at night or during the day, so that she cannot physically scratch on the skin. Okay, and on the marks itself, let's say if the color marks, the brown color marks from the scar doesn't go away after 6 months, you can consult doctors. There are topical agents, there are procedures that can be done to reduce the color. Even on the physical scars, it can be done, but usually they are not done acutely. They're not done immediately. They're usually done after the whole eczema process has been controlled, treated, and there's no more exacerbation. That is when the doctor might discuss with you for this kind of scar treatment, right? So for your daughter, try and keep her nails short. Maybe she needs a proper moisturizer, and maybe you can consult the doctor again to have a look at the treatment, right? Question number 5 from Miss Sun Nilok. If I use the skincare and get redness on my face, does this mean that the product is not suitable for me? Or should I still continue trying that same product for a few weeks and see if it gets better? I used to the product, and see if it gets better. Thanks. Okay, again, I rephrase the question from Miss Sun. She said, if I use a topical skincare product and get immediate redness from it, should I stop using? Or should I just continue using a few weeks and see if the redness sort of like tails out or gets better? So most of the time, there is something that we call contact allergies, contact eczema, contact dermatitis. This is caused by irritation of certain product on the skin. It can be cosmetic product, it can be anything else. Let's say if you have a mechanic that work with oil based product, the oil itself can irritate the skin. Anything that irritate the skin, be it cosmetic products or anything, it can cause inflammation and an itchy rash. Hence, we call it contact dermatitis. One of the common cause of contact dermatitis nowadays is cosmetic products, because they put a lot of chemicals in it that are very, very irritant to the skin. In such case, if you apply a product and it causes redness and itch, I would advise the patient to stop. There is no point on trying to apply more and more. Give it some time and see if it gets better. Usually it doesn't. Usually it can make it worse. Most of the time, yes, you may have bought that product to use, but if it's not suitable for yourself, I think it is better for you to just get rid of it, stop using it, and look for something that is better, that has no preservatives or no perfumes, not scented. It should help. And then if, let's say, the redness doesn't go away after you stop it, you will need some proper treatment by a medical doctor. In that sense, you can consult a doctor, right? Next question is from Milia Ho. Okay. Okay, she says she's using the White Therapy Day Fluid UVA and UVB SPF 30. So can I combine it with that cream together? I mean, to apply it at the same time. So, okay, first of all, she says she's using a UVA, UVB, SPF 30. Okay, that is a sunblock. Okay, and then she asked, can I combine with that cream? When she meant that cream, I think she meant this soothing cream. Yes, if you're using that any sunblock, you can combine it with the soothing cream. There is no problem at all. But in terms of application, what I would advise you to do is maybe you put on the soothing cream first. Let it settle for about 5-10 minutes before you put your sunblock on it, right? So again, put the soothing cream first, let it settle, dry 5 to 10 minutes before you apply the sunblock. That would be the proper way of using it. Next question from Miss Queenie. In cold country, I do apply moisturizer on my face. One of my concerns is pimples, acne. How can I make sure that the moisturizer will not cause acne on my face? A soothing cream can be used on the face. Okay, she's basically worried that by applying moisturizers on the face, she'll get acne breakouts. And she wanted to know if soothing cream can be used on the face. First of all, I'll answer the last part of the question. Soothing cream can be used on the face, no problem. I do not think it's comedogenic in the sense that I don't think it blocks up pores and aggravates the acne. But however, even on using the soothing cream, sometimes you can get acne. You get acne sometimes from traveling. It's not because of the creams that you use. Yes, the cream can make it worse if it is comedogenic and it blocks up the pores and causes initiates the step of acne eruption. But most of the time, patients get acne from traveling is because of the change in the, if you travel to different time zones and when your body adapt, it's not only your skin that adapt, your body also adapt. At a physiological level, your hormonal status also changes in the sense that they may get androgen spurts and so forth, and this will trigger pimple. Most of the time, even myself, when we travel and come back, sometimes we get 1 or 2 acne, but those are usually short term and it should go right away. So in the sense, if you're scared, some patients are very, very particular. They do not like even 1 or 2 acne on the face. So in that sense, when you travel again, pre-plan properly, you can bring a tube of acne medications along with you. Even an Oxy 5, Oxy 10 will do, so that if you have a pinpoint eruption of acne on the first day, when you feel the first point of pain, you can start applying on it. It should help control and reduce the enlargement of the acne. But you should not cut down on the moisturizer use on the face unless it is a moisturizer that is comedogenic. Soothing cream can be used on the face. I don't think it's comedogenic, but the pimple may come from the body adaptation during traveling. Okay. Next question will be from Yuzen. I have good skin, but my cheeks tend to be red when it's hot. It comes back when I'm stressed or working out. Is it normal? Well, what you have, when you say you have good skin, that is good to know. So I would assume that you don't have any illness such as eczema or any form of skin problem. So what you have, red cheeks when you're hot or when you're stressed or when you're working out, this is physiological. It doesn't cause any problem at all. Yes, some patients tend to be more conscious about it, but most of the time, as medical doctors, we do not provide any treatment for it. But patient skins that tend to blush, in this case, they call it blushing, they're more prone sometimes to sun damage. So I would advise patients to use a bit more sunblock when they go out to the sun, right? It can be a bit slightly more photosensitive, and that's it. Next, I found that my skin is, it's part of the same thing that Mr. Yuzen goes on to say that the skin is usually nice in the morning when you wake up, but after the wash your face, the redness come back. Again, it's a physiological reaction of the skin. There's nothing to worry about. And then she wants to know, what is the ingredient that suits the redness in the Eucerin soothing cream? I have no allergy to any food. Is food diet also, can food also affect this redness? If let's say it was a physiological skin condition, food will not affect it. It will neither make it better or make it worse. Again, maybe certain alcohol might affect it. It causes vasodilation, so you will have red skin more. So maybe you can avoid that, but it doesn't do any harm. There's nothing to worry about. What is the ingredient in Eucerin cream that reduce redness? Soothing cream has 12% omega and also lycocalcone. This is basically what it has is actually not to make the skin redness reduce per se. It is actually has anti-inflammatory function. What we mean here is by in eczema patch or a rash of the eczema, there is inflammation. It's not a physiological reaction, meaning it's not a normal condition. It's caused by an illness that causes the skin to become red because there's inflammation. So when you put something to reduce this inflammation, which is the soothing cream, it actually helps to reduce the inflammation and hence the redness will go away. So I will honestly think that soothing cream will not help you reduce redness of your skin, but if you want to use it, you can use it as a plain moisturizer because it will help your skin's moisture, right? Question from Zurina Omar. Hello, doctor. Does eczema fall under the category of sensitive skin? Okay. In Malaysia, we tend to use the term sensitive skin very broadly. So I have patients that come to me, like for example, the patient question posted by Yuzen, where the skin become red when they go under the sun or when they apply thing on it. Then they come to me and say it's sensitive skin, but that is actually a physiological reaction. So in Malaysia, I feel that the term sensitive skin has been used too broadly without the patients really knowing what it is all about. So let's say if you have a condition like Yuzen earlier, that is not sensitive skin. It is just a normal skin reaction that will always be there, right? Okay, well, the true sensitive skin, let's say per se, if we refer to medically, usually we refer to patients with eczema and dry, irritable skin. In the sense that, okay, in eczema patients, they lack certain skin skin physiological materials. That's why their skin is dry and the skin's protective layer is also breached. Hence their skin become more sensitive in the sense that anything can irritate it more, anything can trigger the eczema more, and also the skin is also more prone to infection. Okay, that is the proper, I think, what we usually talk about sensitive skin in medically. But there are also some patients that come to myself and say, hey doc, I have a sensitive skin. When I use this product, my face become red. So I will usually tell them that sometimes it is not that you have sensitive skin, that your skin become red after using the product. It is the product itself that is not suitable for your skin. It irritates your skin and hence cause the redness of your skin. So I'll tell them to stop the product per se. Try and look for something that is more suitable. If let's say, if you're going to talk, for example, just for argument's sake, example sake, if patient come with a moisturizer, a lot of times some moisturizers, they come with ingredients of whitening in it. So when they put on the face, whitening products can be any form of acids. It can cause skin irritation and cause redness. So the patient develop skin redness caused by that product, but patient thinks that her skin itself is sensitive, but it is not true. It is actually the product that triggers a reaction. So let's say if that such patient were to use a moisturizer that is very mild, that is soothing, let's say like a soothing cream, if she were to apply it, I'm sure that she will not have this kind of redness. Hence, the patient doesn't actually have sensitive skin, but her skin has been irritated by certain product. And does eczema fall under the category of sensitive skin? Eczema patients have skin, I would say that eczema patients have skin that needs to be treated properly, need to be cared properly more than a normal patient's skin because of the few things that I've mentioned earlier. I hope that answers your question, right? Question number 10 from Lucas Wong. I used to have severe redness and itch when I go to the gym. Is it because of heat and sweat while exercising? Okay, if you have severe, you used to have, okay, if it's not there, so I suppose it's not a big problem. But there are some patients that develop redness and itch whenever they go under the hot sun and sweat. As I mentioned earlier, there is a condition of the skin that is allergic to heat and sweat that causes urticaria. That means the red patches to come out. Some not even only red patches, but causes the skin to itch. But this medical condition is actually very benign. Nothing needs to be done about it. But if it's very irritable to that patient, you will need to seek a medical consultation from a doctor. And the doctor, if the doctor feels that you really need a preventive medication, they can put you on something oral, maybe you take just before you exercise to reduce this reaction. But usually most of the time, patients also grow out of it. So I think you might be having one of that condition, but if it's already not causing you a problem, I would think it's okay, and then we'll leave it alone. Question from Miss Bobo. I've been using one lotion for my eczema skin for quite a long period, but now it seems like not effective anymore. Is that because of body resistance? Should I change to another moisturizer? Okay, it is good to know that you've been using a moisturizer for a long period of time. Part of the question asks, is it not suitable anymore and should you change? First of all, we need to know what moisturizer you're using. Make sure that the moisturizer does not have any irritable products that can irritate or trigger the eczema. Some moisturizers unfortunately come with them. So usually if you use it at the start, when you first apply on the skin, you start feeling much better. But as time goes by, when the chemical ingredient starts to irritate the skin, it can actually aggravate the eczema. If it is along those lines, yes, maybe you can look at the moisturizer and consider a change. We do have certain moisturizers. We'll not name the brand. Some are made from, there's one in the market that is made from wheat and so forth. I've experienced also using it on patients over a short period of time it helps, but over long term it actually triggers the eczema and make it harder to control. So if you are using one of those, maybe it's time to change. If let's say you are using moisturizer along the lines of like soothing cream, there are a few other brands in the market that are meant for eczema that has no what do you say, non-scented, there's no irritable products in it. If you're using this kind of cream and yet your eczema starts to flare and get worse, you should consider consulting a doctor, because the flare up may be caused by something else and not by the prolonged use of the soothing cream. So it may be triggered by something else, and yes, you may have a acute cause of eczema that needs something more than a moisturizer to control and make it better. Okay, so I hope I answered your question. Okay, the next question is from Woof Meow. I think that must be a nickname, right? Doctor, I have always applied eczema cream in advance before I go under the sun during traveling. But the hot sun, the sweat, and the environment made my body feel like have mosquito bites all over, from my shoulder to my whole body. Okay, next part of it. She goes on to say, eating the medicine that cure itchiness at that moment really help. For me, only two ways help, which is to find an aircon place to make my body temperature cool down, or to have a bath, then the redness will go away. It's really inconvenient, especially I'm traveling far from my hotel. I'm thinking if there is any medicine when applied to the affected area, it will cool the area to make me feel less itchy and subsequently make the redness disappear. I bought one cooler spray before, but it is not cool enough. I'm looking for other cooler spray that athletes spray on their sprained ankles, but I couldn't find. Okay, it's a very, very long question. First, we'll break it down a few parts and answer accordingly. I always apply eczema cream in advance before I go out on traveling. I'm not sure what eczema cream you're applying, but most of the time, from what you have, I can tell you from what you have, it is not eczema. It is what we call urticaria, and yours is heat-induced urticaria from from the heat of the sun. It causes this allergic reaction in your skin that causes it to itch. So if you're using any form of eczema cream, it will not help, right? Also, I've read in your comments that you've bought some cooling spray. Those will not help too. So you can actually forget about looking for cooler sprays that they use on sprained ankles. Okay, again, eczema cream, cooling spray will not help urticaria. Okay, your condition is triggered by heat. It's very important that you know that. What can be done is sometimes you can take some oral medications, consult a doctor, get from a doctor, take the oral medication beforehand before you go out. It will help to a certain extent. But however, if you breach certain threshold, this is very hard for us to gauge how much triggers it. But if you breach that certain threshold, you will still get it. The good thing is that this condition is not dangerous, but it can be very, very irritating, like you said. So what you can do is try and avoid hot countries when traveling. Talk to a doctor, get a prophylactic course of oral medication where you take before you go to such places. Eczema cream, cooling spray will not help. Even the soothing cream will not help, but it can help you. It's a good moisturizer, right? Okay, I'll take the last question for the chat today. So for those of you that still want to send questions after this, you feel free to PM Userin Malaysia on Facebook, right? And you will still get to claim your free product. So for the last question, it's by SP Tan. Hello, I'm Miss Tan. I have dry and itchy right arm. How can I apply moisturizer so that it can be more easily absorbed and effectively reduce the dryness? Okay, okay, Miss Tan has a dry forearm. She wants to know how to apply the moisturizer to make it to let it being absorbed better. Okay, there are a few ways actually. First of all, in very, very severe eczema cases, so for certain cases, after we apply moisturizer, any kind of moisturizer, it can be even soothing cream. We ask the patient to wrap the area, to wrap it up. So actually, it actually increases the skin absorption of the moisturizer per se. What you can do on top of that is use a non-soap-based bath or bath oil. You can use a pH-able Eucerin bath oil or any kind of bath oil that is soap-free. Apply the moisturizer. Most of the time, normal skin, by applying it should be enough. But if you think that it is not helping, you can go on to just keep it under wrap for a while. You can increase absorption, but very seldom we have patients doing it. But if you apply a certain moisturizer frequently enough, for long enough, your skin condition will improve. Only if you find after application of that particular moisturizer for a period of time and yet there is no improvement, maybe perhaps you should consider changing the topical moisturizer. Right? I hope I've answered your question on that. So that was our last question. Again, this is the end of our fifth session of chat. Thank you for joining us. Thank you for all your questions. For those who have questions to be answered, you can still continue posting them to Userin, PM them to Userin Malaysia on Facebook, and you can still claim your free product, a bottle of soothing cream that is worth $65. I'll be seeing you all again next month, discussing on another topic that is eczema related. I hope to see you then, right? Thank you.